listeners, welcome to the MedReach podcast by MedReach Knowledge Sharing Forum, top-notch talk with healthcare experts. I'm your host Roshna. Let me give you a quick insight about what is MedReach Knowledge Sharing Forum. We are the only forum to focus on healthcare management knowledge sharing. Our forum helps you to connect with healthcare industry experts. MedReach Knowledge Sharing Forum is the right place to share best practices, interesting queries and articles respect to the healthcare field. To share and seek in all the fields of healthcare industry, join with us today. Visit knowledge.medreach.in. So today to join with us, we have Paula M. Hall, GM and CEO of the Big Hair Company, Kuwait. She has over 35 years of experience covering the entire spectrum of healthcare industry domestically and internationally. Paula launched her healthcare career as a nurse in the USA from 1979, working with many facilities and covering multiple specialties. Upon her completion of her career, she branched into the admin side of healthcare domain. She worked her way leveled up and she was able to travel to 49 states in the US to work with different healthcare providers. She also have been in many countries like Philippines, UAE, India, West Africa, USA, and currently in Kuwait. So, hello, Ms. Paula. Welcome to the MedReach podcast.
Hello, and it's a pleasure to be here. Thank you so much for inviting me.
So, I have given a short brief about you. I know there are a lot of experience you hold, and let us start this podcast with your self introduction from your side.
Well, as you introduced, my name is Paula Hall. I am a healthcare management consultant. Basically, I can build, rebuild, and restructure hospitals and clinics to kind of put it in a nutshell. And when I say that, I don't mean as far as designing a blueprint or actually lifting bricks to build the facility. I mean the internal structure, the internal mechanisms which make a facility fully functional, leveraging with many quality standards, international standards, and just basically enhancing and leveraging facilities in order to provide proper patient care to everyone. And at some point, we will all become patients. So we should all definitely focus on what is going to be primary sources of care, how they'll be managed, making sure the staff is trained and knowledgeable, making sure we have proper IT systems in place. There's many different areas. I basically say healthcare is a tree that has many branches.
I really appreciate your vision, Paula. So,
Thank you.
okay, to jump into the podcast. As you've been worked with many countries internationally and domestically, what do you absorb this during this pandemic? Like, how does the pandemic change the landscape of healthcare across the countries from management perspective?
Okay. Well, I think we've all literally been slammed and surprised that we would be facing such a pandemic in 2020. And I don't believe anyone really had a clear cut plan of action. Yes, we do have elements where we've designed disaster recovery plans and different things like that implemented in different sectors. But I think this one all took us by surprise, including myself. Um, but I honestly think that on the healthcare side, because we are healthcare providers, we are trained to mentally adjust. We have to be ready for any and everything that's going to affect the health of any individual. So we're kind of trained. Myself, I've been a trauma nurse and I've worked in the ER. And it's like when a case comes in, you automatically know what you need to do because it's all about saving lives. And unfortunately, in this pandemic, we have lost quite a few lives. It breaks my heart. But I think it has taught us that we really need to leverage in our skill sets, become even more knowledgeable as far as pandemics as a whole, how are we going to manage them no matter what they are? This was a serious healthcare crisis. But I think we all jumped in as healthcare providers and we realized we have to save lives by any means necessary. And as healthcare providers, we've taken an oath to provide care to patients, even risking our own lives. And many of us have, you know, but it taught us that we needed to definitely be ready at any given moment for anything that could come our way. And I believe we really leveraged. And I also think that we've realized we don't have to have elaborate offices and things like that. We are coming more together, even on like podcasts like this, webinars, virtual conferences, all of these things. We really came together and realized, you know, we don't have to shut down. We can still be together in multiple parts of the world. We're in a pandemic. We can't be face to face. So we've come up with multiple innovative ways to manage. And this is over a short period of time. So I just feel that whatever we put our minds to, we can do it. I think this situation has definitely proven that.
Absolutely. 100% it's true. We have just thrown our lives to save the people.
Yes,
So moving on to the next question. What are the major
sure.
difficulties faced by hospitals from the clinical perspective during the COVID-19? Managers managed with virtual care and etc. things like more of webinars and conferences. So what were the difficulties faced by clinical perspectives from the hospitals?
Well, I will tell you, just based on multiple of my peers and colleagues that I've communicated with, actually throughout the world during the pandemic, because I'm connected to so many people due to my vast amount of travels, and I'm so blessed and so lucky, inshallah, to have had these experiences. So I'm always in communication with multiple people. How are you guys handling it? What is some of your biggest fears? What are some of your biggest obstacles? And I will tell you, one of the main ones for everyone across the board was PPE, personal protective equipment. I, as a healthcare provider myself, found that hard to believe. These are things that we usually take for granted. We always have an abundant supply of masks, gloves, protective hair coverings, shields. We always have that stuff. We never even have to think about it. Well, the pandemic made us think about it. It became a very crazy business. I actually branched into certain areas of it myself to be able to ensure that my colleagues were getting proper equipment and not just equipment that has been on the floor of a some type of a sweatshop or something like that, where it wasn't up to par to protect the people that have to actually give care to people that are infected. So it became my most challenging. And honestly, everything else, I believe we all came together to just work it out. But that PPE part, we're all going to be patients. Would you want your healthcare provider giving you a mask that is not going to properly protect you? No. So we have to look at things a bit different. Sorry, I know I went over a little bit on timing for that one, but it's my passion to make sure everyone gets proper equipment. That's a big deal to me.
Yes, absolutely. Putting ourselves in the other shoes matters a lot for the healthcare professionals, I would say.
Absolutely.
Yeah. So moving on to the next question.
Hmm.
Mm,
Hmm.
there is home-based care evolving. In future, maybe the home-based care can take over the hospital-based care. So, what will be the role of nursing in home-based care, and how it's going to be in the future?
I don't think that it will take over hospital care. I think it will come to the forefront and maybe balance out. There are times that patients have to be in a hospital setting for uh, diagnosing, for providing certain procedures, sterile environments, different things like that. So there will come a time where this is warranted. But I think we have moved a little bit towards the mode of telehealth and home care, making sure we set up proper facilities that are going to provide the actual staff that's needed to go into the homes and manage the patients is pertinent. We need a full fledged staff that is ready at any time to manage patients on a daily basis, depending on the patient's condition. Now, I know that training usually is something that's put on the back burner because of budget constraints and different things like that. And I totally understand. But I'm a real stickler about training. I have 27 credentials, but I still get training. I'm a trainer. So I have to make sure that whatever I am providing, make sure that I am at the top of my game, so to speak, so I'm able to provide them with the knowledge they're going to need. We have a lot of areas that technology is involved now. I am not a techie person, but I am constantly trying to learn just to be able to implement my services in a proper manner. But training is going to be at the forefront. We have to train our people. Just because they graduate from nursing school and they had maybe 1 year experience, they're still not up to par to treat an extreme case. They need to be managed by levels. We have to provide proper patient care. And if your staff is not up to par, the care that's going to be provided will not be up to par either. This is very important. I push for training all the time.
So yes, of course, the training is a very essential one, and we cannot compromise. And so speaking about the
No.
training, like virtual training
Mhm.
in the healthcare is now being popping up. So how effective it is? Will this help to fill the skill gap in the future healthcare employees?
Absolutely. In fact, I found myself, and I will tell you, 3 years ago, maybe you would have asked me, I would tell you, no way. We are going to be face to face every day because I feel like, well, they need to see my face. They need to see my expressions. They need to feed off of what I'm putting out and grab that energy. Well, guess what? I stand corrected because now we are forced into a virtual world. So I've had to actually come up with new and innovative ways to manage online with my training. I do training for HIPAA compliance, and I have a quality management course. Not really a course, I do mostly workshops. And I have something that's really important: clinical documentation improvement. Our physicians, our nurses, and our medical coders really need clinical documentation. I'm not here to sell services. I'm just telling you what you need. There's many vendors that provide clinical documentation. And I'll tell you why it's important. Everything you document about a patient, that's that patient's journey. We are looking at the diagnosis of the patients. What are the symptoms? What have they had? What have they experienced in the past? What does the family, what type of diseases have they gone through? Okay, this is your makeup of your medical record. And then to provide what is going on with the patient today. How are we going to diagnose it? How are we going to treat it? A medical record tells a story. And if there are any gaps there, that means that story is not complete. That means that we're not going to be able to provide proper patient care and we're not providing quality care. So everyone needs to be trained on this because there's different levels to documentation. Yes, I know there are physicians that they've been documenting for 20 years and it's been fine. Well, yeah, but now things are changing. So with that change, especially when it affects the revenue of the hospital, meaning insurance companies will deny your claim based on a lack of clinical documentation. You're not telling them how you're treating this patient, or is there a treatment plan? Will they eventually have a cure? Will they need to go into a hospital to get further treatment? It has to tell a complete story. And a lot of physicians and nurses and medical coders are lacking in this area. So, what I did in this pandemic, we don't have time for full classroom, 6 hour a day, 6 months courses. We just don't have the time. So I've developed workshops that actually give you the overall basics of clinical documentation, enough for you to be able to actually go through a medical record and fill in all the gaps. Every now and then, we're human, we are going to forget a couple things, but that's where the nurse comes in. Once the doctor's finished his document, the nurse, she's looking it over. She gives her check. Now, she's already been trained in documentation as well. So she's going to know if there's a gap. Then it goes to the medical coder to code and submit the medical claim to the insurance company. Mind you, everybody's had their training.
So the end result comes very perfect in this manner.
Yes, we need it. We have to have it. Money that affects the facility, if they're not getting it, as staff, you have to wonder, where's the money going to come from? You can't turn on a water faucet and the money rolls out. Okay? People are not going to dump money into a failing business. You're supposed to do whatever you need to do to leverage your business and create your revenue, because you can't pay your staff if you don't have revenue, right?
Of course.
So, yeah, I definitely make sure that everyone understands this is a team effort. No one person is going to run this, because one missing link destroys the whole cycle.
Agreed. This is really true. It's a team play. Continuously speaking on the documentation, health records, these days EHR makes it bit more easier, I guess. Adoption
Mhm.
of this EHR is being, it's been like slow these days. What could be the effective way to do it, or some of the best practices to adopt it?
I will tell you, there are a million and one electronic medical record systems, electronic health record systems, ERP systems, enterprise resource planning, that actually includes a full fledged system for HR, finance, auditing, blah, blah, blah. What I find in my many years of experience on the IT side, again, I'm not a techie person, but I do know the mechanisms of an IT system that could be functional in a hospital city, or clinic. Everyone needs to understand, if you're buying a full system with 50 modules and it's not functional, it's because it wasn't tailored for your facility. These are not systems that you just buy off the rack. Like if we go to a shop in the mall, there's size 5, there's size 8, there's size 12. Well, I know personally that's not going to fit me. Okay, I need to go to a bigger size. Okay, but I need it to fit me. So I'm going to go in the dressing room and I'm going to try it out. And I'm not going to pay for a bunch of modules in my system that's not going to be functional. We can't buy systems because they're pretty. Okay, I've seen people do that. That it's very colorful. One department has one piece, the other department they have a whole different module. They integrate, but they're not functional. It has to be functional. You have to decide at the end of the day, what do you want your reports to show you? Okay, and how are
Uh-huh.
you going to extract the information? And is your staff trained? A lot of people, a lot of companies, they drop off the system. Okay, thank you for your $5 million. We'll see you later. And then everyone's sitting there looking at each other like, what just happened? I don't know how to manage this. What are we going to do? It's unacceptable. It's unacceptable. So I really, as companies that ask me, or facilities that ask me, I try to make sure I get everything tailored for them. because we can't just throw systems out there into the world and they're not functional and take people's money and walk away. It's not right. And so I'm kind of that filter in between that educates the healthcare facility and ensures that the IT company is bringing forth what we're going to actually need to be fully functional. That's it. It's very simple. For me, it is.
Oh my God, it's really explained very beautifully and it's too much
Thank
understandable.
you.
As we are speaking about the HIPAA compliances, in a data privacy point of view, there is a HIPAA compliances for US. Across the country, is there any other similar compliances to secure the healthcare data in the future?
Oh, absolutely. Even in the countries that I've been in, I think maybe sometimes we're a little bit slow to adopt HIPAA because when I first arrived, let's say here in the Middle East, HIPAA was unheard of. And when I said HIPAA, people were thinking, oh, she's talking about a hippopotamus, or what is she talking about? Is that a hippo or a hippa? What is that? Well, I started
Hmm.
explaining that we need to really be careful about our patient information. Every patient deserves to have privacy. I have seen in many facilities in different parts of the world, um, nurses communicating with each other. One is at on the south wing, the other one is on the east wing, and they're literally yelling out patient information to each other on the floor. That's totally unacceptable. So the thing is, though,
Oh
you
my
can't blame
God.
them if they don't know. They need to be trained. I don't believe any nurse or any physician or any staff is trying to be malicious by leaking patient information. I don't believe that. I don't want to think that people are that vindictive. Especially, they need to think about the fact that it could be them. So I believe if everyone is properly trained, these incidents will cease because sometimes they don't know. If HIPAA has not been implemented in their nursing program in their part of the world, well, they're not going to know. So you can't blame someone for something that hasn't been taught. So I've decided to implement it's a HIPAA workshop as well. And I am so excited to be able to help others. I'm a HIPAA compliance officer myself. So I definitely would be in a good position to assist others in becoming HIPAA compliant. The thing is, you have to structure it based on the environment that you're in. I can't bring the USA HIPAA here. It does not fit. There's certain aspects of it that we implement, but not everything because we have different structure, different rules and regs in the USA that are not applied in the Middle East or in India or in the Philippines. You have to know your market. So I definitely, being here for the past 10 years in the Middle East, well, I know exactly what's needed and where. So I'm very lucky there, and I'm looking forward to getting started. There are different technical aspects of HIPAA that are being implemented now in certain areas. But I will tell you, HIPAA is a frame of mind. HIPAA is a framework that you implement in your facility with
Mhm.
policies and procedures, vendor agreement, business associates agreements, memorandum of understanding. These are just all
Mhm.
things that are built up to you can place into an IT structure that from department
Mhm.
to department, each staff will know what their role is in HIPAA. And if you have a compliance officer within your facility, that person is responsible for making sure that everyone understands, everyone's trained. I would do training every 3 months to start if I never had a program before. But if I have
Mhm.
something, I would probably do every 6 months just to make sure everyone is on top of
Clear.
knowing exactly what HIPAA is. Hmm.
Okay.
Yeah.
How does the US healthcare system work and how it is different from other countries? Since you have been in the US 1970s, I think you know most better person to share about this. How do you see uniqueness of the healthcare system in US?
Well, without being political or anything like that, I don't like to bring politics into my work. Everyone can pretty much see for themselves what's going on in the USA. But from my perspective, I've always wanted to be in healthcare. Coming from being a nurse, I've seen us leverage in multiple ways. And I think the USA actually set the standards for healthcare in multiple parts of the world. We became a very standardized country, and really booming when it comes to the levels of education, the levels of structure with mandates for the government when it comes to Department of Health. But now in the USA, different states and different regions have different rules and regs. There's government insurance, private insurance, all of these different things. In other parts of the world, not so much. Now, I can speak about here in the beautiful, beautiful land I live in that I call my personal paradise, Arabia. I find it amazing how the rulers of each individual GCC country and countries on the outside look at making sure their people are covered with insurance and making sure they're covered for their health care. I've never been so in love with a country that their actual ruling families and officials cover their people in their country. It's a beautiful thing. Why are why is it that every country doesn't do that? If we are born in the country and we are nationals of the country, like I'm American, why wouldn't my health care be covered? That should be my right. But now I don't want to jump on a soapbox. But I just see it different in different parts of the world. Africa, it's very different. India, it's different. Philippines, it's different. And it's become a business in multiple countries, but I think we've gotten away from the human rights part of it. I will never understand that, and it's not for me to stand here like I'm going to save the world. I wish I could. I really wish I could, because it would be very different. But that's I haven't been given that right to do so. But I just hope it changes, and I hope we're all given proper health care in no matter what situation that we might find ourselves in. Allah bless us all.
Sure, that's really wonderful thing about your country. I think mostly all should adopt this for the betterment of their citizens and so on.
Yeah,
So, we are almost done with the podcast. So,
I see.
shooting you with one final question. Who is your
Yes,
most inspirational person?
I am very honest, and no matter what, I think, me and this beautiful woman, I could have so much conversation with her. Oprah Winfrey. She's been my idol for years. She's going to always be my idol. I know maybe people think she's made some mistakes or whatever, but guess what? Oprah is human like the rest of us are. Have we not made mistakes? I know I have. I don't want to call them all out this evening because we don't have the time. But she is my woman. Her and Ellen. I know it's just one, but her and Ellen, those are my babes. I would literally shed tears if I was to see either one of them in person. So hopefully they'll invite me to the show after they hear this podcast. I commend both of them for handling everything the way that they have handled it. Kudos to both of them. People will agree with me, not agree with me. I'm not here for accolades or acceptance. I'm here to talk to my girl. And I thank you for this podcast. I'm so excited. If I can maybe have one person thinking in a positive way, then I've done my job. And I thank you for that opportunity.
Thank you so much for joining. It was so exciting podcast.
Wonderful. Thank you so much. Hello to your beautiful audience. I am available. Get any of my information that you need from our dear Roshina here, and I will be happy to assist in any way, shape, or form that I can. Thank you all, and blessings.
Thank you. Thank you, Paula, for joining.
Bye bye.
Bye bye.
Hello, listeners. If you have any doubt regarding this episode, follow the topic in our MedReach Knowledge Sharing Forum. Thank you for listening. Hope you all enjoyed the session. Keep gaining the knowledge with healthcare industry expert by MedReach podcast through MedReach Knowledge Sharing Forum. Until the next episode, take care.